The Department of Health and Senior Services says the Omicron COVID-19 variant is spreading rapidly in the Show Me state. Some health experts predict record high case numbers within weeks. Although there are only 13 lab confirmed cases of the variant right now, experts think those numbers are a gross understatement of its spread. Researchers have found the traces of the variant in more than 30 of the state's sewer systems. They've been testing wastewater to find the virus for a while now. Current research teams will predict Omicron is going to push the Delta variant out of the state by next month.
I do expect Omicron to probably by sometime in January have pretty much elbowed out Delta.
The state's health director says, though, there is some good news here. There was a spike in vaccinations just before the holidays. 32,000 doses were doled out on December 3rd, the most since early May, according to state numbers. Flags across Kansas are at half-staff right now to honor more than 7,000 Kansans who've died from COVID-19. Governor Laura Kelly ordered all flags to remain lowered through sundown tomorrow. She encourages all Kansans to get vaccinated as soon as possible. We are seeing promising numbers close to home as vaccination rates are just slightly rising. Numbers from the Mid-America Regional Council show Johnson County, Kansas has the highest rate with more than 70% of people fully vaccinated. In Missouri, Jackson County and Platte counties have the highest rates with more than 53% of people fully vaccinated. Missouri Governor Mike Parson says Missouri is making good progress on vaccinations. He also says Missourians are against vaccine mandates and wants to make decisions for themselves.
But nobody's going to force anybody to take a vaccine in this state. That's never going to happen. But we want to encourage people to do it because we know it works.
You can find a list of free testing sites on the state's website, health.mo.gov/community-test. Top infectious disease Dr. Anthony Fauci says right now his team doesn't think it's necessary to add a vaccine requirement for airline travel within the U.S., but he says it's not completely off the table.
Right now, we feel that the masking requirement and the degree of filtration on a plane is sufficient to keep people safe. However, as is very clearly the case for domestic travelers, as I mentioned, we want to keep them safe, but we believe that the requirement achieves that goal. If there's a need to do more beyond this masking, namely having a vaccine issue, we will seriously consider that as new information arises.
Dr. Fauci adds everyone needs to keep an open mind as the impact of the virus rapidly changes. Testing is still very much a challenge all across the country. You have more people who are wanting to know if they have the virus, but in many cases, they can't find a test. Aixa Diaz is in our Washington bureau to show us what's being done.
The FDA has just approved 2 new at-home tests to increase supply across the country, but it's unclear how quickly Americans will get their hands on more tests with demand so high right now.
Bumper-to-bumper traffic to get tested in North Carolina. Similar scenes playing out across the country as more Americans want to know if they're infected with COVID-19.
I described it as the Hunger Games, and I really mean it. It's not where we should be going into year 3 of this pandemic, and the Biden administration can do a lot more.
The administration says it's working to ramp up supply and make more tests available. Starting next month, the White House says the government will start mailing out tests to Americans who want them.
The government is doing a lot, and we have the need to do more. And I think that was articulated this week. We have 500 million more rapid tests coming in the month of January.
The CDC director also defending new guidance that allows people to leave quarantine after 5 days without testing negative first.
We actually don't know how our rapid tests perform and how well they predict whether you're transmissible during the end of disease.
The CDC does recommend taking a rapid test if you've been exposed to COVID or you start feeling symptoms to know if you are positive. They say those first days of infection are the most contagious. In Washington, I'm Aixa Diaz.